My name is JD Martz, and welcome to Seen and Heard. This is our first episode of a new series we're doing where we're just interviewing to learn about different disabilities that people are contending with in our local community. So I figure for the first episode, I'll, lead by example, and I'll be the one interviewed. So I'm going to let Lauren here interview me, and I'm just going to be answering her questions candidly, and hopefully you'll learn something. So we're just going to get started.
Could you tell me about your disability or disabilities?
Yeah, so I have a spinal cord injury that I incurred in my cervical spine, which is my neck, about 7 years ago. And so that means, there's a problem in my spinal cord, which, prevents a lot of signals from reaching below that point of injury. So I don't really have any arm or leg movement. I can move my shoulders. And if you see anything else move, it's just, a spasm, which is an involuntary movement. Maybe I'll even try and set one off at some point. There's a little one. But I've been contending with this for about 7 years. And it's been a ride, and it's like, being someone who lived able-bodied for like a lot of my life, it's almost like a fracturing of your personality a little bit. You kind of get like two lives now living in one body, but one of those lives isn't attuned to this body, if you know what I mean.
Okay, so you said, is your disability acquired, or have you had it since birth?
Oh, yep, it's acquired.
And how long have you been living with this condition? You said 7 years. Was it gradual, immediate? Yeah,
it was immediate. So yeah, right when I believe my chin clipped the sandbar when I was diving into a wave, I immediately felt the disconnect. And then you kind of spend time in a trauma center, you spend months in the hospital, in the ICU, in rehab. And at that point, you're kind of like, it's really those first 2 months where they talk about, oh, this is where you're going to see what you get back, essentially, from the injury. And so during that, you're like hoping and praying and all that stuff, but you kind of like are also almost re-sliding into your own body. So certain things are waking up, you're feeling certain things, and they don't feel the same way they used to. They might feel like really intense static or something like that, and you're not sure if that's a bad thing or a good thing or what it is. So it can be very confusing.
How do you feel right now in relation to your disability?
Right now, I'm pretty okay with it. I go day to day without it plaguing me too much in an emotional way. But there's definitely a lot of things that just come with this situation that are a lot of hurdles. But at the same time, it definitely gives you like a brand new perspective on a lot of things. I feel like it's made me more humble. I'm a much better listener, much more patient now. And I think I've totally shifted my personal relationship with time and how I utilize time and what's important to be done in that time.
How do you think people see you?
Honestly, that changes for me day to day sometimes. But for the most part, like, subconsciously, I just think they see me as me, how I've always been. But when I get in my head a little bit about it, I can feel like, oh, this is a big chair. Has a lot of equipment on it. It has this straw, which is just my water. I have this head array, which is what I use to drive the chair around. But who knows what the hell a head array is? Like, most people don't know what that is. I didn't know what it was until I got one. And it can look pretty intense. So, I look at some people and I wonder, like, oh, do they think, like my disability extends beyond just like a physical aspect? Like, am I have some sort of traumatic brain injury or something I was born with from birth? Like, all these things that I had as almost thoughts or prejudices when I was able-bodied, looking at other people in wheelchairs. Like, I worry those things. But honestly, most of the time now, I kind of just go with the flow and don't really worry too much about what other people are thinking about how I look and stuff. And I kind of just dress and wear what I like and what I enjoy. And probably the person I care most about seeing how I look and what they think about how I look is my wife, Yeah.
Makes sense. Perfect sense. How do you feel about yourself?
I feel good about myself. I just feel like sometimes I struggle with just like the day in, day out, like routine that I have to go through to just get myself ready in the morning. It's very different from what most people go through. I have to be assisted in literally everything. So all of that can kind of wear on you. And like when you get up after all that, it's like, that was just my morning routine. Like I'm supposed to be refreshed and ready for the day. But sometimes you can just be like exhausted by that. And you're like, almost feel guilty, and you feel like, oh man, I have so much I got to do this day, but I'm like kind of tired because maybe my bowel routine or my shower or something did not go well, and that's a whole nother subject in itself. But like all of that thing, all of us humans, we all have rituals in the morning, I feel like, and it gets us ready for the day. It could be drinking coffee, splashing water on your face, taking a shower. And it's like, I feel like mine are just so much more high stakes now, because it really affects how my body feels throughout the day and everything.
How have you changed?
So I think I kind of touched on this before, but it's like, I've definitely gotten more humble, better at listening and understanding just what people are trying to say to me. And I try to just kind of like put myself in a lot of other people's shoes more often now. But at the same time, I understand that like everybody's experience is so individualized, because you learn that with this injury. You see other people that come out of the hospital looking like you, and you're like, oh, let's talk about some stuff. Like, what can we chat over that, we're both dealing with that's similar? And you start to learn that like, no matter how similar they look to you, their experience could be wildly different. Like you see me, I, can't move my arms and legs, but I also can't like go to the bathroom on my own. I also have like really extreme nerve pain. So my body feels completely different every day. And then I could see someone and I'm talking to them who looks similar to me and they don't have nerve pain whatsoever. And so that like question of feeling and all that stuff is totally shifted, because if I'm being honest, I would almost rather get rid of my nerve pain before I would be able to walk again. I think the dealing with that and the energy it takes and the energy it sucks out of you is just such a heavier load than what I deal with just being paralyzed and relying on other people to help me with stuff. Granted, I'd love to get rid of that as well, but it's the nerve pain, I think, is probably the thing that covers everything the most.
Is there a particular ADL that plagues your daily life? Maybe something that an able-bodied person would take for granted?
So that kind of ties into what I was just talking about with just the morning routine and everything. And it's just like, if I could delete that, I feel like my days would be so much longer. I'd have much more hours in the day, because my morning routine takes me about like 3 hours, and it's like sometimes 4, depending on the PCA I'm with, which is a whole nother battle of finding reliable people that you can love and share your vulnerabilities with and get to help you with these things. And it's definitely the morning one that is the longest, most strenuous. And you learn in this position that you either do this or you allow them to put a colostomy bag on you, which brings a whole nother set of challenges and potential pitfalls with it. And, it's something like right now, it's like the devil, essentially. That's like what you go with, because that's what you're used to right now. And it could get worse, but it could also get better, but you don't really know. And you're not as much of a gambling person anymore because of what you've experienced in your life.
Anything that I didn't ask about you that you want to share?
I think I kind of touched on it, but like, it's really important, I think, for people to know that it's not always what you see that's like the disability. There's going to be people we're planning on having on the show that I think will have very invisible disabilities. And like, I have a very visible disability, but I also have a very invisible disability in my nerve pain. And something like that is so powerful and so strong. And I think I expressed that before by saying that I would rather get rid of the nerve pain than the paralysis if I had to pick the two between the two. Although saying that out loud now, I still question it. I don't know. You know, if I was able-bodied and I could go out and be active like I used to, maybe that could push some of that nerve pain away, because maybe it's the concert of being stuck in one position while being, battered with this pain that it feels very black hole-ish. And like, I think if I could move around, I could maybe beat through that. So again, it's one of those things where it's hard to pick one of the two, but yeah, maybe I would get rid of the nerve pain first. I just wanted to say thank you for being with us. And, I want to keep coming back with more of these, and we'll see how they go in the future. So thank you very much. I'm JD Martz, and have a good night.